In this video, we're going to be talking about the relationship between arthritis and the Achilles tendon. Quite a common set of questions that are asked are, does arthritis cause Achilles tendinopathy, or can an Achilles tendinopathy or tendonitis be a sign of arthritis? So we're going to be talking about what are the different types of arthritis, is there a link to problems with the Achilles, what could that link be, and how can we then manage that afterwards? I'm Ali, I'm one of the physios from treatmyachilles.com. We're an online virtual physiotherapy platform treating all things related to Achilles injuries. If you would like to find out a little bit more about our services or to book an appointment, please have a look at the information below. So what is arthritis? Well, broadly speaking, we can divide it into two categories. The first category being something called osteoarthritis, which is one that you might have heard people talk about before. And the second category being something called inflammatory arthropathies, which basically mean a selection of different types of arthritis or different types that would be looked into with an inflammatory response to what is going on and how that is affecting your body. If we look at the first one, osteoarthritis, well, what is that? Well, it's a change in our cartilage, and that change in our cartilage can be quite mild and not really cause us any bother or any pain, or we can have increasing symptoms from that. And it's important to note that if we have symptoms from an osteoarthritic change, it doesn't always indicate that the worsening symptoms I have, the worse my arthritis might be, and the same, the less symptoms I have, the less worse my arthritis is. So symptoms don't always correlate with pain or changes in the joint or how worse some of our diagnoses might be. We have got some videos based on pain describing that in more detail, and they can be found in the description below. So we have a change in our cartilage, and sometimes we also might get an increase in a thickening of fluid that goes in those joints. Now, osteoarthritis can affect one joint, it might affect other joints, but it doesn't follow that just because you've got it in one joint, it's going to spread, or it's going to get worse and turn into having problems in all different parts of your body. Osteoarthritis is something that can be managed well by looking at our general health, by also looking at how strong our muscles are around those joints and how flexible those joints are. And that is some of the best evidence base out there to help look at it. So osteoarthritis can be part of pain, stiffness, or swelling inside some of those joints if they're particularly angry at that moment. Causes of osteoarthritis, there is some more evidence base coming out, and the evidence base is showing there can be a link with genetics, there can be a link with age, there can be a link with gender, sometimes more women have it than men. There can be a link with high BMI or obesity levels, and there also can be a link with previous injuries or joint surgery to areas. Now, just because you've had joint surgery, or you're a woman, or your nan had it, or anything else that we've talked about here, just because you've got those things doesn't mean you're going to get osteoarthritis. They are just things that they've looked at in studies, and they found that these are the most common denominators, which also means that there are people out there that have those things and never get osteoarthritis, and people that get osteoarthritis that don't have any of those things either. Our second group is called the inflammatory arthropathies. Now, things you might have heard that would fit under this title is rheumatoid arthritis, psoriatic arthritis, ankylosing spondylitis, or gout. And these have a bit more of an inflammatory response to them. And that inflammatory response is affecting our system as a whole. And you might find that you don't just get one joint affected with that. You might to start off with, but it might be in multiple joints over time. It may involve lots of inflammation and heat and redness in joints over time. But again, that might come and that might go. Quite a few of those have links to different particular joints, and we'll come on to talk about that when we're talking about the Achilles and relationship with it. And they also can be seen as autoimmune diseases or illnesses. Those are the types that you may have seen a rheumatologist about. You would be diagnosed by having blood tests and looking into your whole family history and looking for particular things in those blood tests or particular genes that you may have. There's more and more evidence base growing about knowledge of all of these different conditions, and there's lots of different ways to manage them. So if you have pain, stiffness or swelling in a joint that's lasting more than a few weeks and you're concerned and you would like to get this checked out, please go and visit a doctor, because there may be some tests and some things that they could look at just to see what's going on and give you a bit of reassurance. So is there a link with arthritis and Achilles tendonitis, tendinopathy, tendinosis? Let's use those terms interchangeably for this video. Yes and no. There is not a link with osteoarthritis and the prevalence of Achilles tendinopathy. You could argue, like with any injury or ache or pain, we may walk differently or move differently, or our joint might be a bit stiffer or not in certain places, which might have a knock-on effect to how we're walking, which could irritate an Achilles, but that could be just the same as if you'd fallen over and twisted your ankle, or you'd slept funny for a few days and your back was a bit sore. So there isn't a direct correlation with osteoarthritis and Achilles tendon problems. There can be a link with some of the inflammatory arthropathies. Quite commonly, this would be your spondyloarthropathies, get my word in, so things like ankylosing spondylitis. Spondyloarthropathies means common within the spine area, and again, you would have been diagnosed this by seeing a rheumatologist potentially, or having blood tests and other scans and x-rays. So this doesn't mean just because you have back pain that you have this diagnosis at all. So that's a common link. And also so is psoriatic arthritis, so psoriasis-based arthritis. Again, an autoimmune issue that someone would have taken your full history, maybe looked at whether your joints or your fingers are puffy and swollen, you've got any changes to your nails, you've got a history of psoriasis, and again, they would put that all together to create that diagnosis. So again, just because you have psoriasis doesn't mean you're going to get psoriatic arthritis. And just because you have arthritis doesn't mean you're going to get psoriasis. Two different things. So how are they linked? They tend to be linked to something called an enthesitis. So an enthesis is the area where the Achilles attaches to the back of the heel. So we've got a nice picture showing where the Achilles comes down and attaches right at the back, at the bottom. Wherever a tendon, doesn't matter where it is in your body, attaches to a bone, it's called an enthesis. If we look and zoom in on that Achilles area, we would also see that we would have some of that joint capsule around that area. We'll have a fat pad, which is an area that helps protect where that Achilles might come closer to the bone. And we again have fat pads in different areas of our body. It might also have our bursa, which is a sac of fluid, and that sac of fluid is a bit like an airbag. It's again a nice buffer to stop things rubbing, and so they can move and slide and contract and do all the things that we would normally do. All of that area added together, plus those joints, where it attaches, is your enthesis. So you can get an enthesitis if you have these inflammatory conditions that we just spoke about, and those enthesitis is itis, inflammation of that enthesis part. So you can be diagnosed with pain down at the bottom there, which is called an insertional Achilles tendinopathy. And Mareka's done a video on the difference between an enthesopathy. An enthesopathy is your tendonitis of the tendon where it attaches at the bottom, insertional tendonitis, or an enthesitis, which is then related more to these arthritic conditions. Please have a look in the link below if you would like a bit more information on that. So how do I know which one I've got? Have I got an enthesitis or have I just got an insertional Achilles problem? Well, if you haven't been diagnosed or have any other symptoms related to inflammatory arthropathies, then the odds are you've probably got an insertional Achilles issue, and we have loads of videos on how to manage that, and you can again find those in the link below. If you are at all concerned and you don't know whether you have an inflammatory arthropathy based on what you're hearing, that's where you would then go to the doctor and you would be able to perform different tests and an assessment to find out whether they would like to take that any further. So let's pretend we have that and we have an enthesitis. That enthesitis, well, how do we know whether that Achilles is a problem or not? It's quite tricky because one of the things we would do for any insertional Achilles area is we would have a prod on it, we would squeeze it, we would have a press, and it would be tender. And that tenderness can give us a clue that it's Achilles tendinopathy, but it also can be an enthesitis. We would look to see whether it might be hot, red, or swollen. So that's more likely to be an inflammatory response, which fits with our enthesitis. Again, there could be some swelling and heat and redness if we had an irritation around our bursa in somebody that doesn't have that diagnosis. So again, quite ambiguous. We could scan and have a look under an ultrasound scan, and there is starting to be some more guidelines about what to look for and diagnose with this, but more work is being done with this from a research perspective, so we don't have all the answers, but you're looking for lots of things around that enthesis area. So all the things we were talking about, is there fat pad irritation, is there changes around where it attaches to the bone, is there irritation in the Achilles and changes itself, and the sorts of changes you would look for is thickening of the Achilles and anything where you have got an increase of blood vessels and nerve endings called neovascularization in that area. Marika has done a video on what to expect when you have an Achilles tendinopathy or tendonitis and what that means. And again, they are the same things that you might find, and you can see that in one of our videos, links in the description. So then you'd also be looking for, is there any inflammation around that area, anything affecting the bursa? You would be putting that together with that person's history of what else is going on in their body. Have they had the blood test? Have they been diagnosed with this? And that's when you would start to think, okay, I'm suspicious that it's this enthesitis. So how do you manage that area? Well, to manage that area, it's not too dissimilar to an insertional Achilles tendinopathy. So again, watching those videos may well be useful. You could also have a bit of both with this. So your Achilles has got a tendonitis, a tendinopathy, but also your enthesis is there's an enthesitis. There's inflammation of those other structures around that area too. So in a nutshell, that you would be called enthesitis, but you might have multiple things that are causing it. So to start off with, we want to try and relieve some of the inflammatory response that's there, and that's very different to a normal management of insertional Achilles. And that would come down to discussing this with your doctor or your specialist that's looking after you. This could mean taking anti-inflammatories, but again, that would need to be prescribed and check that that's the right medication for you and what's going on with the rest of you. And it would also be something that they may consider other medication that you might need to manage that whole inflammatory arthropathy as a whole. So for example, we have a video on gout, and that video on gout talks about uric acid, and there's also sorts of medications currently called like allopurinol, particularly in the UK, and that's something that you may well be prescribed. So there are common medications for different types of inflammatory arthropathies. And again, if you'd like to find out more information about gout, please have a look in the link below what we have here. So let's say we've done that. You've gone to see your doctor, they've given you whatever medication is appropriate, you're starting off. What else can you do? Well, something else that's different to an insertional Achilles tendinopathy is that sign of inflammatory response, that redness, that heat, that feeling of swelling. That's something that can be used with ice packs. Those ice packs can be wrapped in a towel. They could be placed over that area as long as you are aware to monitor the sensation so it's not getting too cold. You're looking at keeping that ice pack on 10 minutes or so until it feels like a comfortably numb, cool feeling, not numb, I can't feel it anymore, more of a, oh yes, I've calmed that down. Other things to try is to try and offload that back of the heel. So wherever all those structures come and attach into the back of the heel, the more we can keep that slightly raised, the more comfortable walking, moving, and also calming down those structures, the more comfortable that might be. So footwear with a higher heel to toe drop. Again, I'd probably put that in both sides to even everything up. And we're talking short term here to calm it down, to then be able to remove that as we need to over time. And also you might add some of those heel cups or heel wedges that'll give you a smaller heel lift. So again, a higher heel to toe. You may find if it's really acute and not very comfortable to walk, quality trumps quantity. So again, if it's comfortable for your arms to use sticks, things like Nordic walking poles when you're out for longer walks, again, might just spread that load so you can walk with better movements than you had been if you were limping. Shorter strides. Those shorter strides, again, are a little bit easier because when we do stride out, we tend to try and land nearer the back of our foot and roll over to the front of our foot. So if we're landing near the back, it might be a bit tender. If we're rolling over and pushing off on our toe, we're contracting that Achilles tendon, which might be a bit sore. So our shorter strides, the less exaggerated that movement is, again, while things calm down. If all of this is heading in the right direction, things are settling, you're being managed well with your medication, but you're still getting problems around that Achilles tendon, or there's been signs of that on some of your imaging, if you've had any, then that's where some rehab exercises are useful. Even if we were talking about not doing the exercises just because we have an Achilles tendinopathy, in general, keeping our body flexible and keeping it strong is going to help look after those joints and all of the musculature around it. So getting some guidance on the right exercise for you is important. This area of the body can be quite tricky because it tends to be a little bit more irritable than if you had an Achilles tendon higher up. Not in everyone's case. Some people may find that it's okay and it settles quite quickly, but other times it can be a little bit more irritable, especially if we have something that rubs on the back of our heel, or we knock our back of the heel, or again, we're having to walk, so we're having to take lots of steps in a day, and every step might be a bit more uncomfortable at that back. So that's where looking at a structured strengthening program comes in, and you might start with things like isometric exercises, so that's raising onto your tiptoes and holding. You might start with some seated exercises using bands or using weights, or you may be able to do standing exercises, and we will have a video and do have videos on insertional Achilles exercises and what to do and not to do, and it's worth having a look at those. However, what I would say is that this is very individual, therefore you would want to gain advice from a professional to be able to find out what you currently can do, how strong you are, and is that now not quite what we're working on. We're trying to calm down pain first, so it might be we're doing easier exercises than how currently strong you are, just to calm things down so then we can build up. Or we might be finding about how strong you are now, everything's pretty calm, and we can just keep going and push that strength. And if we can build up that strength, then you're likely to be able to do more. Your Achilles and that enthesis is a bit more robust, doesn't get irritated, and then we can go on again. But this is part of that wider management of that whole inflammatory arthropathy. So in summary, can arthritis cause an Achilles tendinopathy? In short, no, it can't, particularly if we're looking at the osteoarthritis type of arthritis. If we're looking at inflammatory arthropathies, we'd want to look at you as a bigger picture. It may irritate, and there's a higher proportion of people that have got those conditions that get irritation at that insertional area compared to people that don't have those conditions, or that have it in different areas of that Achilles, although not many studies I've been reading have been looking into, for example, psoriatic arthritis and higher up Achilles. They tend to focus the studies and the research on the bottom. So there may be a link there. How do we manage that? We first need to look at, is that inflammatory arthropathy being looked at by a professional? Have you been assessed for that properly? Are you on the correct medication? Can we calm down any inflammation? Secondly, what can we do from a strength and mobility perspective with tailor-made physiotherapy exercises or strengthening exercises that can help that area of your body?